Hey everybody, my name is Kinshawda Daniels and I am going to be talking to you today about caregiver documentation. So for those of you who have home care agencies or home health agencies, your caregiver documentation is going to be very important to your agency. So we're going to be discussing that. I'm going to give you the 5 key points when it comes to documentation. So I'm going to give you 5 key points for that. All right. So the first key point is for your caregiver documentation, and this is your caregivers are going to be mostly non-licensed. Your non-licensed caregivers, some of you, and depends on what state you're in, you will also have licensed caregivers, which will be your CNAs. And then those of you who hire unlicensed caregivers, they would be simply a caregiver. Basically, that would be their title. Okay, so the first thing that you want to address in your documentation is the appearance of the client. So whenever you're documenting and you're addressing these 5 key points, you want to make sure that you do a very good visual assessment of your client. Now, this is not the type of assessment that typically LPNs or your RNs would do. This is just a visual assessment. You're looking at the client, you're looking at their body to make sure they don't have any bumps, bruises, cuts, or anything out of the ordinary. Or if they're not if they're stuttering or they're blinking their eyes or they can't focus. Those are the type of things that you want to document when you do a good visual of their body. Now, and you're not going to ask them to get undressed or anything like that. This is just what you can see, what's visible to you. You want to make sure and document. Now, if they tell you, hey, I fell, I bruised my knee or my arm, then at that time you can ask them, is it okay if you take a look at it? Because if they're reporting something to you, then you want to make sure that you're doing all you can to document it and then report it to your superior. Okay? So that's key point number 1, their appearance. Now, key point number 2 is the environment. Okay, so we all know in home care, you're going out to the client's home. That's, majority of what we do as home care agency owners. Of course, there are times that we may send our caregivers out to facilities. If we are contracted with ALFs, which are assisted living facilities, group homes, hospitals, for sitter services, anything like that. But for the most part, they're going to be going out to the client's home. So you want to take a quick look of the environment. You want to assess any safety issues, any torn rugs, any broken glass, anything that could be a risk for your client, especially fall risk. That's the number 1 thing that seniors typically deal with are falls. So you just want to take a quick look, whether, as you're going throughout their home performing your services, just take a look around, look on the floor, on the counters, make sure knives and things like that are in their proper position, in their proper place. You want to make sure the shoes they have on is not going to create a fall risk for them. They shouldn't be too big and very floppy or very slippery shoes like that. But you do want to make sure that you do a visual assessment of their environment. And you can say simply in your documentation, no safety risk noted, or no safety risk observed in the client's home, in the client's bedroom, or however you want to word it. You want to make sure that you are notating that you didn't observe any safety risk in the home. As well with their body, you just their appearance, you want to make sure that you note in your documentation the client is free from any bumps, bruises, scrapes, or anything like that. Now, I'm not asking you to, or telling you rather, to document on the level of a LPN or an RN, but you do need to document well enough and detail enough that it will cover you as a caregiver, and also cover your agency if anything was to come up. If the client, if something was to happen to the client, or if something did happen and it wasn't documented properly. So documentation is very, very, very vital. All right. The third key point is their mood. Believe it or not, you want to make sure that you document their mood. The client appears to be cheerful today, or the client appears to be happy, or the client appears to be sad, because if they're not feeling like themselves, if they're sad, or not in the mood to talk, you want to know why. It could be they're grieving, or they're missing a loved one, or they're not feeling well, or something going on that you may not know about. So you always want to make sure that you take note of their mood. How are they feeling? Are they talking to you? Are they cheerful? Because sometimes a change in mood can indicate that there is a problem health-wise. And if so, you definitely want to be able to document that as well, so that it can get addressed. Okay, so your fourth key point is going to be the task. So your task, when you're completing your task as a caregiver, this is going to be performing their laundry. Okay. So this is going to be, whether you're washing dishes, doing the laundry, or taking out the trash. You want to document everything that you've done during your visit, because the tasks generally are going to correlate with the care plan. So you want to make sure that in your task you're addressing things that need to be done. You're providing the services that is being billed to Medicaid, or whether it's Medicare or whatever. You want to make sure that you are providing those services as a caregiver to your client in the home, and you want to make sure that you're documenting that, so that in the event of an audit, they will be able to see, okay, that the client, has been getting these services and is benefiting from these services. All right. So point number 5 is incidents. You always want to make sure at the end of your shift, your visit, that you document inside of your note that there were no incidents, so that would protect you and also protect your agency. So you want to make sure that that's known and document. This shift was free of any incidents to report, or no incidents to report during this visit. And it's something as simple as that. So you always want to make sure that you're detailed, but also that you're putting in the necessary information that's needed, and not information that's above your scope of practice as a caregiver or a CNA. So here's some little nuggets that I want to leave with you. You want to always make sure that you are addressing the needs in the care plan. As I said before, the care plan is there for a purpose. Is to keep the client on track with their goals, whether they're meeting the goals or whether they're exceeding or not meeting their goals. So that's something that the treatment team needs to be aware of during, whether it's a 3-month, 6-month, or 1-year evaluation. That is vital information for them, for the client. So another nugget is any notes that that contains information that's required for intervention. So typically your LPN and RN. Okay, so so you want to make sure that the way you're documenting is on your scope of practice. So you don't want to put any information in there that requires a intervention by a licensed or nursing professional. And okay, so another nugget here, you want to report any changes, especially the negative changes that your client is making, whether they're declining or they're constant having mood swings. Any change in them that is negative, you want to make sure that you report that to your superior, and then let them lead you on how to include that in your documentation and what to do next for that. So also, documentation is important for your agency, clients, and the insurance companies that you may be contracted with, because at any moment you may have to be subject to an audit, and you want to make sure that your caregivers are documenting properly, clearly, and efficiently, so that anybody that can read those notes, they'll know how the patient is, what's going on with them. They'll have an insight on the environment, how they're living. So you want to give them just a little snapshot of the client and how they're doing. So keep that in mind when you're documenting. Now, I'm not saying you have to document on the level of a LPN or RN, but make sure that you're putting in the vital information so that anyone comes behind you, they'll know exactly what's going on with this client for the last month, 3 months, 6 months to a year. So you want to make sure. So for those of you who want more information or need more assistance with making sure your caregiver documentation is up to par, I am a licensed practical nurse. I'm an LPN. I've been in the healthcare field since 2002. I've been in the healthcare field. I've been I worked 4.5 years in psychiatrics. I worked substance abuse. I've done most of my nursing career in home health. So please follow the link in the bio.